In almost every family, at least one breadwinner is missing who could contribute to the support and alleviate the poverty. More than 5 million Cambodians live on less than $1 a day. Poverty in the countryside is particularly bad. Some 80% of the population of Cambodia live here. Many women and children are undernourished and ill. The hard work in the paddy fields saps their strength. The brackish water is contaminated with bacteria and a breeding ground for mosquitoes. Very many people in the countryside suffer from malaria, dengue fever, bilharzia, dysentery and bacterial diarrhea. Many die of these illnesses, above all, the children. There's hardly any medical help and care for people in rural areas, because the few hospitals are much too far away, or simply because they cannot pay for treatment. Close to the Vietnamese border is this state hospital. It is the only one within a wide surrounding area. Many patients have come a long way. In order to be able to pay for the treatment for themselves or their children, many have sold their cattle, their house, or even their land. Only someone who can pay in cash will be helped here. Seriously ill patients lie in the corridors. Children play in between them. Many patients have AIDS, malaria, tuberculosis, venereal diseases, or hepatitis. Infectious patients and babies lie together in the rooms. Despairing children massage their dying mothers, helpless attempts to alleviate their pain. Anyone without any relatives in this hospital to cook for them and nurse them is left for the most part to their own devices. There are no nurses to take care of them. Waste and clinical rubbish are piling up in the inner courtyard. The sanitary facilities are used by all, patients and their relatives. There are 4 toilets and 1 wash basin, without running water, at their disposal. Dr. Daravut, the physician in charge, has long since reached his limits. This patient is suffering from severe diabetes and ulcers that will just not heal. Dr. Daravut lacks both the specialist knowledge and the necessary medicines to help her. The people in the corridors all have AIDS, he says. He cannot help them anymore anyway. There are only a few well-trained physicians in Cambodia. Most of them fell victim to the terror regime of the Khmer Rouge or fled abroad. In the clinic laboratory, samples are tested for tuberculosis. Almost all of them are positive. The few appliances which are at the laboratory assistant's disposal are obsolete, covered in dust, or even already broken. In this hospital, it is almost impossible to make an accurate diagnosis, to treat patients appropriately, or even to nurse them to health. For a good diagnosis, we would need laboratory equipment to type blood samples and an X-ray unit. We lack a sterilizer for operations and we have no ultrasonic equipment for examining pregnant women. All that does not exist here. This hospital complex is in Kampot, one of the least developed regions in Cambodia. A model project for the whole country is intended to be created here. A training center for Cambodian physicians and medical personnel, but above all a hospital at which women and their children will be treated optimally and free of charge. Dr. Fanita shows us the hospital in which there's everything, but no equipment and no staff.
You can see here, these are rooms, open rooms. This is designed for a conference or a training room. So the back of the idea is to have it on-job training session in this room as well. This is an emergency where the ambulance can come at the end of the other way, but they also can have patient come in directly by walking in from the entrance. The advantage is that you can have emergency here, And if the patient need operation, you can prepare it and go through this operation room immediately without losing time. And if you turn left, so you go into directly to the operation theater, which is the actual operation take place in this area. So now here's from this door on, you come into the clean area where the patient will be brought in to the actual place where the operation take place. You come in, and now we are sitting with two operation room. One is mean that you can do two operations at the same time. We open into where the bed of the patient will be here. There will be light where installation will come. These are all the pressure meter, controlling pressure in different rooms. Make sure that the flow of the air is not backward into the operation room, but to be outward, so that the cleanness, which is an essential part of the operation, is controlled.
Next to the operating section are laboratories and a complete obstetrics department with delivery rooms and medical care rooms for newly born babies and premature births.
So now we are in the X-ray department where everything is ready. You have here is conventional X-ray where the door is well protected. So this is the room where the doctors will come and sit down and have the picture the patient read here. So this is a kind of doctor office in the X-ray department.
There is also a pharmacy, several treatment rooms for gynecologists and pediatricians, dentists, ear, nose and throat specialists and ophthalmologists, and of course wards for 100 inpatients. Everything is ready.
This hospital is ready, and it needs equipment to start. And we can start this anytime when we have the equipment. And there's a lot of children are waiting to see this hospital, and we have a lot to offer to the population in Cambodia and to the whole population in Cambodia. And we must one day see this hospital start.